certainly doesn't apply to this room, which I'm really happy about. But like I have friends in college, they will tell me, they know for a fact that if you raise taxes, tax revenues will go up. How do you talk to someone like that?
Where do you go to school?
I just graduated from a school in Seattle.
Seattle.
Yeah.
Well, that's
Which,
Seattle.
I mean, Seattle is kind of like Washington.
I understand. I'm joking. This is not a joke. Back in, it's the Reagan years, Bob Packwood, who is from Oregon, you're a neighboring state. I think I'm right about this, Malcolm. You remember this? They sent to the Joint Tax Committee staff, or somebody, some gurus of stuff on Capitol Hill, and asked this question: if we raise taxes on incomes over $250,000 a year to 100%, right? Am I right, Malcolm? 100%. How much revenue would this bring in? And well, let's say 100%. The answer, of course, is none, zero, nada. The devil wears nada. No revenue would be brought in by a tax rate of 100%. But Joint Tax staff said it would bring in $50 billion or something, right, Malcolm? Go ahead.
That was a CBO.
But in CBO, okay. Same difference, okay. But anyway, so, yeah, you're right. This is like Oz. This is the,
Like, it's so
unreal.
common sense to us, but...
Wait till you've been here as long as I have. God help you if you stay that long. But no, it's wacky. I mean, it's really wacky, and it doesn't make any sense. But people like you can change this. You can. This young lady here.
One of the issues that could probably everybody in this room can relate to, at least most people, well, in addition to healthcare, which rising costs are really affecting families.
Sure.
Another aspect that's affecting families is the college tuition
Correct.
bubble or the student debt loan bubble. I was wondering if you had any comments about how that could impact the future of America's economy.
Well, the college tuitions and college loan programs and college aid programs, all of the above. What they do is enrich colleges. And as there are more aid provided, the tuitions go up, the fees go up, everything goes up. And the first thing, I remember Chris Forden was asked this very question when he was here at the press club, summer of '08, before the book came out. And he was asked that very question: if they increase student aid or whatever, what will happen? He said, tuitions will go up. That is correct. So you as a student become a kind of enabler. The money is in your name, but it's really going to the institution. But the professors get the money and the administrators get the money. You don't get it. And you're going to wind up with big debt also. That's going to be another, no matter what the aid program is, you will be in hock for 10, 15 years after you get out. Yes?
One of the things that we haven't discussed about economics is externalities. And so the saying goes in environmental policy and in education policy, the market can't actually decide what the ideal price is for education because there's an externality. The benefit of education is not perceived on the individual level, it's perceived on the social level. And so parents will always choose less education than what their child should need. Can you address how those weird economic...
Well, I'm not sure. Certainly it's such a problem. What Ronald Coates called the problem of social cost. And there are externalities that exist when you have, I'm not sure it applies here, but when you have the tragedy of the commons, where you have people engaged in activities that there's not really a market for them. And because they're not, in other words, if somebody, like a park is publicly owned. And so there's no owner to look after it, to make sure that it isn't, extremely garbage, and the grass gets cut. There's nobody to do that. And that there's an externality there because people then will abuse that because it doesn't belong to them and it doesn't belong to anybody else. That is an argument for privatizing as much stuff as possible. Because when stuff is privatized, when somebody owns something, they have an incentive to look after it and take care of it. And if somebody else does something to it, they have a remedy at law to be compensated for the damage done. That does not exist in commonly held goods, the tragedy of the commons or the air or any the oceans or waterways, and that then does require some degree of control and regulation. You have to have it where you cannot privatize. Although even there, like riparian law and so forth, there are ways of doing, introducing property rights into river problems, for example, riparian rights. So therefore, the real logic of that problem is to go the opposite way and to privatize as much stuff as possible so there'll be an owner and there'll be somebody who has a stewardship of that, whatever it is, to protect it from invasion. Whatever the residue is that cannot be handled that way, and it should be reasonably small, has to be handled through regulation. So, now, are any...
Other questions?
Are we done? Right here, yes, sir.
Bringing it back to
Yes, sir.
the healthcare thing,
Yes.
you said one of the main problems was that it's a third-party paying system.
It's the main problem. Yeah.
And like, so right now, my employer pays my the insurance.
Most of it.
Yeah, who pays, for my healthcare stuff. So by removing the employer and giving me vouchers and health savings account and whatnot, it's still, unless we're assuming that we're taking on most of our health costs directly, if we have insurance at all, it's still a third-party system. Like, they're still paying.
Well,
See where I'm trying to get at?
I do, but
it comes closer, but they're still a third-party.
No, that's true. That's true. However, to walk it back a little further, what we're talking about is to take the same benefit that's now extended, and instead of making it a in-kind benefit that you lose if you don't consume it, you convert it into a cash voucher, or whatever you want to call it, that you then keep if you don't use it. Huge difference. You then have an incentive to be careful about consuming it. You could then take that and it isn't, it's the whole, even now the worker has to pay part of it. But say $8,000 or $10,000 a year, it's a lot of money. And if the worker has that money in an account, and I think it should be very elastic boundaries. I think it should be allowed to do a lot with it. But it should primarily be to buy health insurance. But it's health insurance for which they pay with their own money, not somebody else. And they would then have an incentive to shop around, do all this stuff, and maybe have catastrophic, which means a high deductible, and pay the difference out of pocket. Well, they've got to, if you have catastrophic, it kicks in at, I don't know, $5,000.
That's all I've got.
There you go. Well,
I pay $2,400 a year for insurance.
okay, well, that's a lot cheaper than...
Hey, tell me about it.
Yeah. But most people don't have that, and when you have that situation, then you have in the account the money to pay the deductible.
Yeah.
You cover it. It works like a charm. So therefore, it's so obviously simple that naturally they don't do it. It makes way too much sense. We've got to do more studies, like the lunch thing. It's very simple to the lunch. We need a task force and maybe a commission and a bunch of hearings, the lunch crisis and the healthcare crisis. Okay, anything else, Malcolm?
Actually, yeah, what?
Back here.
Oh, I'm sorry.
You can go ahead. So my question has to do with, even though I agree with you, healthcare may not always be the best economic principles. What about healthcare as a right? Because 18,000 Americans are dying every year because they can't afford it. What about them?
If there's a right,
Do you believe there's a right for people to have that chance to live if they can't afford it?
a chance to live, how many people are dying,
18,000 members every year.
And that statistic comes from work?
I don't know the exact source.
All right, well, people die every year from all kinds of things. Health problems. I nearly died from health care problems myself. And undoubtedly will, not too long. How many years from now, I don't know. That is very unfortunate. It's not a right. You have a right. If you have a right to something, then somebody else has the obligation to provide it to you. You have a food? Could you live without food? I don't think so. I couldn't. And do I have a right to food? Well, not really. I need to pay for it. I go to a restaurant, I say, I'm here to claim my right to that food. Bring me food. They will not do this. They will say, yeah, you can have food, you pay. Here's your bill. That's the way the world works in reality. You have a right, a house, to have a right to my house. Well, I need shelter. I would have been in very bad shape without a house in this blizzard. Nobody provides me a house for free. I pay for it. I need a vehicle to get around. I need clothing. Does somebody have to provide this to me for free? I don't think so. That's not the way it works. Now, if there are people, it is true, there are people who are very, very unfortunate and indigent who cannot afford any of these things, housing, or medical care, or food, and we have programs for that. We have food stamps, we have public housing, we have Medicaid, and so on, for the indigent. And that's why I wonder about these people who are dying. They can't get Medicaid?
Some people can.
Why? I don't know. Okay. I can tell you one thing is happening under this system that is depriving people of rights that they should have, or things that are promised to them, is when you have these kind of runaway costs, when you have these massive overruns of healthcare costs for private employers or for the government, the people paying the bills try to control that. And what they do then is to ration care, rationing. You know what HMOs are? Health maintenance organizations. They're rationing machines. That's what they exist to do, to ration and deny care, because the costs are out of control. And when our good friends in Congress back in '95 passed reforms, part of the Contract with America, they pledged to cut $270 billion, am I right, Malcolm, out of Medicare. And they voted that. The House Budget Committee in 1995. And they said, yes, we all vote for this. We will cut $270 billion out of Medicare, just kind of like they're talking now. And then they looked at each other and said, well, now what do we do? They had no idea. How are they going to do this? They had no idea. It's an entitlement program. You cannot cut an entitlement program which goes up automatically. So in come the HMOs saying, we can do it. Oh, good. Then do it. Go do it. And they did it. And what they did was they turned over all these Medicare patients to Medicare HMOs, who proceeded, and we looked into this with great care. They were beautiful people. They went out to recruit Medicare patients. You know this, Mal? And they went, and one of my favorite anecdotes is they had recruiting sessions to sign up Medicare patients at a Holiday Inn. It was at a Holiday Inn on the second floor where there was no elevator. So, if I'm lying, I'm dying. That's right, right? Right. And they got with the girl with it twirling her hair, talking about the new philosophy of health care, which is to deny care. That's the philosophy. And so they recruited the healthy elderly, who cost them nothing. But they got like $5,000 per capita for everyone they signed up, and they signed up a bunch of them. They did give them, what, orange juice?
And breakfast at Denny's.
Fair enough. That's what you got for your $5,000. So then, God knows how many billions that they siphoned out of the system. That'd be a lot. Then, of course, these people, eventually, elderly folk like myself, do get sick after a while. and they need some health care. Well, then they have other things that kick in, which are matters of outright denial of health care, which is rationing. That's what you get when you have a third-party payment system out of control. That the employers and the government, say the HMOs or somebody, ration the care, deny the care. And it'd be the same thing to come back to our lunch crisis, this lunch crisis that I conjured up earlier. And they said, well, the only way to stop this crisis is we need a lunch maintenance organization. A lunch maintenance organization will go to the grocery store and monitor you shopping there. And as you go down one aisle to say, well, I think I'll get that porterhouse steak, the monitor would say, oh, no, 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 we do not pay for that. That's not approved. We don't pay for no porterhouse steak anymore. The hamburger helper is right over here. And that is approved, but no steak. That's what would happen. It'd be the same thing, rationing, this kind of system. So whoever these unfortunate folks are, if they in fact are indigent and they need food and clothing and housing and health care, they should be taken care of by the welfare safety net. But we don't screw up our entire health care system for that reason. Okay, Malcolm, I think, are we done?
I guess
Okay,
so.
wait, John Burlow, go ahead, John.
I wanted to point out something. Since we were discussing this when I was in the National Journalism Center in the 90s,
We
right
were.
when Clinton care was there,
We were.
the Republicans and the Bush administration give them credit for one reform that sort of levels the playing field and makes, and sort of is a partial fix for the third-party payment problem. In 2003, attached to the Medicare prescription drug bill, which was otherwise a terrible bill,
Certainly was.
they greatly expanded HSAs for working adults.
Yes, they did.
Now you can contribute and get an income and payroll tax deduction, just like the
Correct.
employer can get pay place with pre-tax dollars up to $3,000 a year if you have a $1,500 deductible or more, or your employer can contribute it. You keep it, the interest, none of that is taxed.
All good, all good.
The account, and Obamacare is trying to take that away.
Correct. And everything you say is true. And my only, that was an improvement. It needs to be improved a lot more. There shouldn't be any limits on it. Not just
Right.
3,000, but you're right, that did happen. Malcolm, are we done? Our work here is done?
Yeah, pretty much. Thank you for coming, and we got the book